Hi, this is Sarah Meixel, and today we're here with Dr. Lisa Becton. She is the Director of Swine Health Information with the National Pork Board. So thanks for being with us today, Lisa.
Thanks for having me.
Very good. With the attention that comes along with has been coming along with antimicrobial use or antibiotic use, what role are diagnostics playing in the industry from that perspective?
Diagnostics play a very critical role as we manage all of our antimicrobials. So what it starts with is the relationship between the veterinarian and the producer. And so when a producer has a problem, it's up to the producer to contact their veterinarian to have them come out and assess the situation. And a part of that is to take the appropriate diagnostic samples to understand what the problem is, what's going on. And then when you get that information back, that helps guide the veterinarian in giving their recommendations to the producer on how best to deal with this issue. When we have diseases like PRRS, which is a viral disease, it's hard because antimicrobials don't work on viruses, but what happens with PRRS is that it compromises the pig's immune system, and so then you're going to have other bacterial information that come in. So it's really important to understand not just one factor, but multiple factors when you do your diagnostics. So I think it's going to continue to play a very integral role in how veterinarians and producers work to address their health issues.
Very good. And we've been talking a lot at the conference that we're at just about sometimes diagnostics, a negative tells you a lot, right? I mean,
yes.
It's not always just a positive outcome you're looking for, that specific answer, but there's more to it than that. It's just part of the puzzle, right?
Correct. And a lot of people, we do diagnostics for a lot of different reasons, and sometimes is actually to look for freedom of disease.
Right.
And so we may want to know in a health challenge what's there, but you also want to know what's not there.
Right.
And then same thing if, say, you're shipping breed stock to another company, or if you have a customer that buys pigs from you and has a problem, you want to make sure that there is or is not something going on. And so even if you get a negative result, that's not always a bad thing.
Right.
It just depends on what situation you're running those diagnostics. But they're a very big role for us in what we do every day as a veterinarians to try to help guide our producers and help them with their issues.
Very good. So it sounds like diagnostics are really to help you get more specific.
That's correct, because unlike our human counterparts where human patients can tell their physician what they're feeling, what they're doing, we don't have that luxury. So we have to be able to take appropriate samples of our patients, which are pigs, to really give us the full story. We can see clinically on farm what they're doing, but really helps us more, what are they exposed to, what viruses or bacteria are they exposed to, and so that just rounds out the whole clinical picture and then gives us the way to deal with that issue.
Very good. Well, thank you so much for your time today, Lisa.
Thank you for inviting me here.
Very good.